Yeah. All right. Hey guys, it's 11 o'clock. So let's see. Yeah, okay. Well, good. We are going to get started then. I'm Michelle Damian with Insurance Advisors Direct, excuse me. And this is Rob Roberts from Priority Health. And we are going to be just talking about the 5-star plan and how it can be utilized year round and how to go after that business year round as well. We will be touching on certification. So if you haven't been certified, Rob will talk about that. We will have a little segment at the end. So yeah, let's just get this started then, Rob, and go ahead and introduce yourself.
Yeah, well, thank you very much. Rob Roberts, Priority Health. Been with Priority Health for just about a year now, not quite. Great organization, great people, good plans, and I was really excited about the opportunity to come over to Priority Health. For those of you who may have known me prior, I was over at PHP, Physicians Health Plan, helped launch that MAPD product, which is a regional carrier based over in Lansing, Michigan, and their footprint was Lansing, Saginaw, Kalamazoo, and kind of those counties through that middle swath of Michigan. So when I came over to Priority Health about a year ago, I was assigned to Southeast Michigan. So my territory includes Macomb, Wayne, Washtenaw, and Monroe counties. So any agents utilizing Priority Health Medicare, individual Medicare, in those areas, I would be your rep. Priority Health, yeah, I think does a great job in servicing not only your clients, the beneficiaries, but agents as well. We actually have 5 reps that service just Medicare. So myself in Southeast, you have Connie Elkins, who's in Oakland County. It works her way up into the thumb over to let's see, Flint, and I'm not sure exactly how far north she goes around the bay there. Anyways, we have 5 reps that do work the entire state of Michigan, which you look at a lot of companies, maybe they'll have 1 rep for the entire state. So we really do try and provide a high level of service there, with that understanding. So, um, but I should probably figure out how to share my screen here real quick. All right, here we go. All right, so just as mentioned, we're going to cover a couple of things. We'll talk about the 5-star, which pretty excited about, and just the opportunity that brings to agents. A lot of the feedback that I've gotten from agents over AEP is that our market's kind of evolving, right? We used to be able to rely on 80% of our business during AEP, and really not have to work too hard outside of AEP because you were able to gather or acquire so many clients during AEP, whether it's through mailers or different opportunities, flyers, etc. But I will say it does seem that beneficiaries are getting so much pressure, fishing term there, um, with commercials and people calling them, call to see if you qualify, take their information and then sell that information as leads and mailings and everything else. The return rate on the mailers are just not what they used to be, right? It used to be 2% was something that you could rely on to continue to grow your book, get those leads, closing ratios, all that would kind of come into play where you could really develop those relationships and have a nice AEP. But it seems to be evolving now with everything that's going on. So one of the things that I generally recommend is, becoming part of the community, developing those relationships based on referrals, right? Since the return rates are just not what they used to be prior to COVID, and people don't seem to be attending educational events or sales events like they used to prior to COVID. So I think we're in an evolving market right now. I think developing relationships with financial planners, accountants, dentists, P&C agents, group agents, right? That don't do Medicare for one reason or another is going to be key, I think, to not only growing your book the how you want to, but growing it year round and not just focusing as much on AEP. So, with that being said, we were really thrilled to achieve the 5-star rating because that does allow agents to write Priority Health year round. I love all the different shades of green that we have on here. So. Don't judge. I had to do these slides myself. So, and I am certainly not a marketing person. So I thought we'd talk about a couple of things initially. Just kind of a quick review of OEP since we're in the middle of OEP right now, and then 5-star. OEP, as you guys know, January 1st through March 31st. Now, this is the area where I call buyer's remorse, right? So really, OEP is designed for someone on an MA plan that wants to change to another MA plan, right? They purchased an MA plan, they have buyer's remorse. Maybe the doctor doesn't participate, the coverage isn't quite what they expected, or who knows, right? There's a million reasons why someone might want to switch back to their old plan or even to a new plan. One of those reasons might be a disruption with Kroger Pharmacy and Express Scripts. You guys have probably heard about this. So any carrier who utilizes Express Scripts or ESI as their PBM, their pharmacy benefit manager, Kroger Pharmacy is no longer in network. Okay. Now, Priority Health uses Express Scripts as our PBM, but because we have a new relationship this year and a couple of plans co-branded with Kroger, Express Scripts gave Priority Health only the exception so that our beneficiaries, your clients, can still go to Kroger and be in network. Any other carrier who uses Express Scripts, Kroger Pharmacy is no longer in network. Now, this is going to cause a disruption, right? This could be a reason why someone utilizes OEP. Maybe they go to Kroger Pharmacy to get their prescriptions. They like going to Kroger Pharmacy. They get their grocery shopping done. They know the people there. They have relationships. This could be a reason why someone could utilize OEP, switching from an MA plan to one of our MA plans. Okay. Now, that's going to continue until Express Scripts and Kroger can play well in the sandbox together. Who knows when that's going to be? Okay. Now, the 5-star actually began the day after AEP, began December 8th, and runs the entire year through November 30th, 2023. One of the reasons, there's a million reasons as to why someone might utilize the 5-star. But one of those is if you're big in the sup market, Michigan has a fund that subsidizes the subsidy premiums for some people. That ended February. So you might be getting some calls from beneficiaries who are on a supplement plan who lost their subsidy, their premium subsidy on their sub plan, that don't want to pay that. You could certainly utilize that as a 5-star. Now, remember, OEP is MA to MA, right? So anyone on a sub plan after January 1st is not going to be able to utilize OEP. They'd have to utilize the 5-star. Now, I bring up these couple different scenarios, and there's a million of them that you could look at. But I bring up these scenarios because if OEP is a viable option, utilize that first. Okay. Utilize the OEP enrollment first before 5-star. The reason I say that is because you can only get one 5-star SEP election per year. And if you use that now, you've exhausted that. So if OEP is a viable option, use OEP first. That way you have the 5-star SEP in your back pocket if needed. Okay. So just a quick overview in regards to OEP. We kind of touched about some of this, and I'm going to go through these relatively quickly. If there are any questions, just I don't know, raise your hand here. I'm going to see if I can pull up the chat real quick. Although it took me how long to figure out the share
Yeah, I
screen.
have it over on my end. I don't know if you
Okay,
can
great.
see it on your,
I've got something kind of hiding it on one of my other screens, but not a problem. No big deal.
okay.
Um, So OEP qualifications, like I mentioned, it's MA to MA, and they would have to be enrolled in both parts A and B. If someone's on a supplement, that doesn't qualify them. They have to be on a Medicare Advantage plan and switching to another Medicare Advantage plan. Okay, so just a reminder there. Um, as I mentioned, so one MA plan to another MA plan. Now they can also disenroll from an MA plan and go back to original Medicare if they wanted to. If they choose to do that, I don't know why someone would do that, but if they did, that is an option. They can do that. And then if they did choose to go back to original Medicare, they would be allowed to enroll in a Part D, so that they wouldn't have that penalty. The purpose is just giving people the opportunity to switch plans. Again, I refer to it as buyer's remorse. It just helps me kind of keep it in my mind as to the purpose of OEP and what's really trying to be accomplished. But I didn't want to spend too much time on that. That's kind of a review. Here's why we're here, right? The 5-star rating. CMS comes out with their star rating, and really the feedback I get from agents is beneficiaries don't really talk about this a lot. The star rating doesn't come up a lot. I will say that the star rating does come out after carriers kind of have everything printed. So this is why we're, kind of scrambling to get effectiveness from the 5-star plan. So I thought we'd talk a little bit about what actually goes into that 5-star rating in case those questions do arise. But it is an exhaustive formula that goes into the star rating that CMS evaluates. And these are just the primary categories, right? These are the 5 primary categories that CMS evaluates a carrier in when determining a 5-star rating or a rating for that matter, right? A star rating. So they look at the HEDIS, which is the Healthcare Effectiveness Data Information Set. Try to remember that. CAPS, which is the Consumer Assessment Healthcare Providers Systems. HOS is the Health Outcomes Survey. Pharmacy and operations, things like grievances, et cetera. Now, underneath each one of these categories are 100 subsets. It's incredible. I actually got a little training on this once we did attain the 5-star, and the team that kind of did that presentation. It's remarkable everything that gets tracked and scored and evaluated to go into that star rating. And CMS generates a formula for that every year. And what a lot of people don't know is those categories, that I showed you and that you kind of see here on your screen, remain the same from year to year. However, the weight of each of these particular categories can vary from year to year. Now, what my compliance team indicate is that CMS in recent years has put a heavier weight on employee, I say employee, beneficiary responses. Okay. They get surveyed, and, that CMS has put a heavier weight within that star rating formula to evaluate carriers in that area as opposed to other areas like outcomes, for example. So this is why, I think as someone has a star rating, and you think about that, if this formula changes or the weight within each of these categories varies from year to year, the carriers don't know what CMS is going to do next year. Now, if that trend continues, we could try and, operate accordingly. But CMS doesn't tell us, here's what we're going to do for 2024. They just come out with it and evaluate us and then let us know based on that formula, which they will then provide after the fact. So this is one of the reasons why it's so hard to really attain a 5-star rating or even maintain your star rating. Because if you're basing that on the old formula from the previous years, that could look a lot different. You could have done just as well based on the formula from last year, but if they change that, again, the categories wouldn't change, but the weight they hold to each particular category can change. And you can see the percentages here, 33% for caps. So just a little education there. If a beneficiary does inquire about what goes into a star rating, these are some of the conversations that you can have, with them. So reasons to use the 5-star election. I'm not going to read through each of these. Here's kind of the quick and dirty, so to speak, right? Kind of like buyer's remorse for OEP. Look at 5-star as AEP year round. Okay. If someone is eligible to utilize AEP, they would also be eligible to utilize the 5-star SEP. The only requirements that a beneficiary has to enroll through a 5-star SEP is they have to be enrolled in both Medicare Part A and Medicare Part B. Okay. So we can discuss how many different scenarios there might be. And as many as we discuss, I guarantee an agent will call me in a month and come up with one that I'd never thought of. It's incredible. It just happens. This is really nice. It really is. I would say last year when the Blues had a 5-star rating, at least once a week, an agent would call me up with a particular scenario that they've come across with either a referral or someone, that's a client of theirs, what have you, and say, what do I do? Like, what do I do? I don't know what to do. Maybe they missed their window of opportunity for their initial election period. Maybe they missed their window of opportunity coming off of a group plan. Maybe they were healthy. They just never even enrolled in Part D and whatever. There's a million scenarios that you can think of. The only requirement to utilize the 5-star SEP is that they need to be enrolled in both Medicare Part A and Medicare Part B. Okay. So just to kind of keep it simple. Now, if any of those scenarios arise, you're not sure, give any of the reps a call. We're happy to assist. We do have our, contact numbers. So for example, I think just about all of us have our cell numbers available on our business cards and on our signature. I don't know any of us actually have our work number, but just to give you an idea, I had an agent submitting an application last night on our new Connector platform. It was 11 o'clock and he called me and I answered and we kind of walked through it. So encourage you to use that. That's one of the services that we can easily control and separate ourselves from the crowd, right? Why can't you use the 5-star election? Now, this is really specific to us, right? Because on here I have listed PPO and DSNP. And you guys, I'm sure know this, but when CMS comes out with a star rating, they do it based on plans, right? So you have a PPO, an HMO POS, and a DSNP or HMO. Our PPO is 4.5, our DSNP is 4.5, our HMO POS plans are 5. Okay. So utilizing the 5-star SEP, if you select a PPO and indicate, or a DSNP and indicate 5-star election, that would not be approved. Our platform, our enrollment platform, will not filter that out. Okay, so if you pick a PPO like the Edge plan or the Compass plan, and you select a 5-star election, which is on the electronic application, it will not filter that out. Okay, the platform will not filter that out. We didn't know we were going to be a 5-star plan until after our platform was launched. So a nuance there that I want to make you aware of. Be very mindful that if you're using the 5-star SEP, you select one of the 4 HMO POS plans that we offer. And really it's going to come down to 2 plans, because 2 of those 4 are legacy plans and have a premium tied to them. You're not going to sell those, right? But what you will sell is the Key and the One. Those are the 2 plans that are 5-star eligible. They're HMO POS plans. And again, the beneficiary only requirement there is that they have to be enrolled in parts A and B. So if they're not enrolled in parts A or B, they would not be eligible for the 5-star. And here we talk about the eligible plans real quick, right? So again, it's the HMO POS plans. We have 4 total. The Key, the One, the Value, which is a legacy plan that has a premium tied to it. And our original 19 years ago, we launched the Priority Medicare plan, which is also an HMO POS that also has a premium tied to it. So the Value and the Priority Medicare are not going to be plans you're going to be looking at. There's a premium tied to those. There's 55 zero premium plans in Southeast Michigan. 55. The plans that you're going to look at are the Key and the One. The beautiful thing about the Key plan is, one, it's a popular plan. There's more beneficiaries enrolled in the Key plan than any other plan in the state of Michigan. And it's also available in all 68 counties in the Lower Peninsula. So what a great opportunity to have that plan as a 5-star, right? So not only can you enroll people year round for just about any reason, as long as they have A and B, it doesn't matter what county they live in Southeast Michigan. You can enroll them in the Key plan because it's 5-star, right? So you get a referral from someone in Petoskey, great, roll them in the Key plan. You get a referral from someone living in Pigeon, great, enroll them in the Key. Anyone know where Pigeon is, by the way? Where
No.
my, it's where my wife's from. There's an actual town called Pigeon. But my point is, what a great opportunity to have our HMO POS plan as a 5-star, because the Key is available in all 68 counties. So just a tremendous opportunity there. Um, the Priority Medicare One, also a very good plan, a much smaller footprint. We'll talk a little bit more about those later. But again, the DSNP is not 5-star, nor is our PPO. Okay, those are 4.5. So the Key plan, as I mentioned, available in all 68 counties. How beautiful is that? That is great. And in a good, solid plan, right? This is the most popular plan in this state of Michigan. More beneficiaries enrolled in this plan than any other. And all we did for 2023 is enhance it, right? We embedded an additional $1,500 of dental benefit in that plan from last year. All of our plans have embedded dental in there that include cleanings, x-rays. We embedded an additional $1,500 of dental on that. It does come with the travel pass. So if you guys are familiar with the travel pass, all of our plans come with the travel pass, with the exception of our 2 DSNP plans. The travel pass, if you're not familiar with that, allows beneficiaries to go anywhere in the US, seek services from a provider that accepts Medicare, and be billed as in-network. Okay? All of our plans have that. So just overall, a good plan. I will say that there are, you can see a range of copays depending on the benefit. That is because with the Key plan, depending on the region the beneficiary resides in, those benefits may vary a little bit. And you can see here under the PCP visit, if the beneficiary resides in regions 1, 2, and 5, it's a 0 copay. If it's regions 3 and 4, it's a $10 copay. Regions 1, 2, and 5, I believe, was it 75% of beneficiaries reside in those 3 regions? something like that. Might even be 80%, I can't remember. But the vast majority of people that you'll come across will reside in regions 1, 2, and 5. But a good solid plan here, and again, available in every county in the Lower Peninsula. One of the changes that we did make to all of our plans this year is Tier 1 90-day preferred retail. We transitioned to a zero copay. And in doing that, we made slight alterations beyond that, right? So you have your ambulance, transportation, it was $250. It's now $270. So we had to offset that benefit somewhere else. And that kind of leads me into, I'm going to go on a tangent here real quick. But a lot of carriers you'll see, particularly in the D-SNP market, will use kind of some outrageous ancillary benefit levels to attract beneficiaries, right? And it happens, it works, right? You'll get a beneficiary that will come to you and say, I want my $5,000 of dental benefits. Well, CMS pays carriers so much based on star rating, based on diagnostic code. There is a formula that goes into what CMS will pay a carrier for that particular beneficiary. And it's so much per month, right? And so what carriers do is try to develop plans that will attract beneficiaries. And that's why some plans might have a little better benefit in transportation. Another one might have a little better benefit for hearing aids. Another one might have a little better benefit for whatever. But it's basically a shell game. Carriers are getting paid so much money, right? It's a finite amount of money. And it's basically taking that money and shifting those benefits around depending on where they believe the needs within the market are. So what happens is when somebody offers $5,000 of dental, it's not sustainable. It's window dressing, right? Because what happens? The beneficiary comes to you and says, I want my $5,000 of dental. Sure, I can do that. I'm certified with them, no problem. Well, within a year or two, they take those benefits away. So now what you're doing is you're spending your AEP rolling your book of business over instead of growing, right? We take a little bit different approach with that. We have more sustainable benefits. We don't make drastic changes in benefits one way or the other to increase retention. Our retention rate is 12% higher than the industry average. Okay, now what that means is if you're retaining 12% of your book more and more every year, you don't have to roll that book over and you're starting out at a higher point in growing that book every year, right? So it's a little bit different approach that we're taking than a lot of carriers are taking in the market right now. It's a very quick, easy sell to say, yep, I got it. 5,000 dental, here you go. And, but the problem then is, they're going to pull that benefit away at some point. Are you going to be able to retain that client? And then instead of growing, you're going to be rolling that client over to another carrier, most likely, because when you reach out to them or they'll reach out to you and say, hey, I want to look, they changed my benefits, right? So it's just a little bit different approach. I think that's one reason why we overtook the Blues over the last 3 years. Is a big part of that is retention, service, and direct provider directory, right? So the key plan, a very good plan. And then the other plan that is 5-star is the one. The one is new this year. It's on our HMO POS platform, so it does qualify for the 5-star. As you can see, a much smaller footprint, but a really good plan. So Wayne, Oakland, Macomb, and then Kent and Ottawa out west. The one thing about this plan, if a beneficiary resides in those counties, it does come with a nice travel benefit, and it's not a D-SNP, right? So it's a MAPD plan with a travel benefit. That's not a D-SNP. So if your beneficiary has a need for transportation, this is a great plan. One, it comes with the travel benefit itself, as you can see here, 31-way trips, but then also the Papa Pals. And this particular plan has 100 hours of Papa Pals, which can also be used as transportation. I'm going to talk a little bit more about Papa Pals later. I think that's a phenomenal benefit that's not utilized as much as it should be. So you guys need to be really pushing that benefit. But overall, a great plan, a really nice low max out of pocket. So something to think about there. Um, and just a good solid plan. Um, and you can see it wasn't available in 2022, so we don't have that comparison like we did on the key plan. A couple of notes. The 5-star SEP election. So if you run across a scenario 5-star, and you have a paper application, you're going to enroll them in the key or the one plan. On our paper application, we printed those off before the star rating was available. 5-star SEP is not an option on our paper application. I shouldn't say it's not an option. What I should say is it's not listed as an enrollment option. So what are you going to do if you don't want to record your calls, you're meeting face to face, you want to develop that relationship? Take the paper application, enroll them in the 5-star, draw your own little box, 5-star SEP, and check that box. Okay. Create your own, I'll say. Create your own. Now, when you take that paper application and you're entering it electronically into our enrollment platform and submitting it that way, because that's the only way I recommend you do it. Don't do it any other way. It is available when you are submitting that paper application electronically. Okay, so I go meet with a beneficiary, I create my own box on there, I take my paper application, I come back home, I log in, I'm entering that paper application electronically. 5-star SEP will be the very first election that you can choose. Okay, so a little nuance there. Just a reminder, if you select a PPO or a DSNP under a 5-star SEP, the enrollment platform will not prevent that from going through. It will go through. So be very mindful that if you're electing a 5-star SEP, it's an HMO POS plan, the one or the key. Okay. Be very mindful of that.
Question here for you,
Absolutely.
Rob. Like, so when it comes to the hospital network, and, Kalamazoo with Blodgett and Borges and all of that. So is it just that if they want to double check with the doctor there at one of these specialty type of hospitals, and as long as they bill out, then everything is covered?
Are you
And
talking about the yes?
in network, I'm sorry.
Yep. So I'll talk a little bit about our network in Michigan. Priority Health's really nice, and I think this is one of the reasons why we've seen such growth in recent years, and that is our provider directory in Michigan, but also to include that travel pass outside of Michigan. So we have one provider directory for all of our plans. I know a lot of carriers will have a provider directory for their PPO product, their HMO POS product, and their DSNP product. So they'll have 3 contracts, right? Most carriers. And a provider may participate with the PPO, but not the DSNP, or the HMO POS, but not the PPO, right? And so it's a different provider directory for each plan. Priority Health has simplified that. We have one provider directory for all 3. So when you do a provider directory search, and it says Priority Health Medicare, they will accept the PPO, the HMO POS, and the DSNP because it's one contract. Okay. And that's all the contract is. Contract just says if you see this person who has this benefit or this in this carrier, you're going to charge this amount, right? So it's just a contract. We have one contract for all 3. That's extremely unusual, particularly for the DSNP market. So if any of you are big in the DSNP market, that's where we excel far and above anyone else, because our provider directory includes every health system in Michigan.
That's a good point.
Everyone. So you want to go to U of M, you want to go to St. Joe's, you want to go to Beaumont, you want to go to Henry Ford, you want to go to Ascension, you want to go to Anyone, doesn't matter. You can go. If you're DSNP, that is highly unusual. Doesn't happen.
Mhm.
So what a lot of carriers are doing in the DSNP market is saying, look at all this dental benefit I can give you. Well, what about your health care, right? Who can you see? At Priority Health, we talk a lot about access to care, right? One of the discussions that I ask agents to have in that market in particular is great. Somebody comes to you and says, I want my $5,000 of dental. That's great. Enroll them, get them into your book of business, but have this discussion with them and say, look, if you're having trouble accessing that benefit because you have one dentist in 3 hours from your home and you have to wait 6 months to go to that dentist, um, you know, let them know that, look, I've got another carrier where you can access the benefits that you buy. Maybe it's not $5,000, maybe it's $3,000 a dental, but you can go treat with any doctor you want, any health system you want, right?
Mm.
So we talk a lot about access to care, and I think that's one reason why we've grown so much in the last 3 to 4 years, particularly in the DSNP market. You're going to get people who just want to chase the over-the-counter benefit from quarter to quarter, right? You're going to get people who just want to chase the dental from quarter to quarter. That's fine. That's not our bread and butter. Our bread and butter are those beneficiaries in the DSNP market who take their medical care more seriously than, you know, an extra $5 of OTC. Now, that market in particular, you know, that's a big part of that market, right? Chasing those ancillary dollars. That's a big percentage of beneficiaries in that market do that. So we're not going to be the best fit for everyone in that DSNP category, but that is our appeal versus the approach that some of the other carriers are taking, right? If that makes
Mhm.
sense. So our provider directory in Michigan, we have 95% of PCPs, 95%. And again, that's for all three plans, right? All three, PPO, HMO, POS, because it's one provider directory in every health system. There's one tiny health system in the tip of the thumb that has 135 beds. It's a hospital up there. It's the only one that does not participate with Priority Health. So unless you have someone who lives in Pigeon, which is where Pigeon's at, right at the tip of the thumb, you don't have to worry about provider directory with us. Now, the travel pass comes on every plan that we offer except for the DSNP. And the reason it doesn't include in the DSNP is because the DSNP is a state funded benefit. Okay. But our HMO POS plans and our PPO plans, the travel pass is included. Okay. And again, that travel pass is if the beneficiary seeks services from anyone in the US outside of Michigan, because they have to be contracted in Michigan, right? So we have a contract for providers in Michigan, but any provider outside of Michigan who accepts Medicare, beneficiaries can go to that provider and will be billed as in network. Okay. Now, some carriers have only certain states they'll do that in. We're anywhere in the US. And again, we talk a lot about access to care. Um, so hopefully that answers the question.
Yeah, no, that was great. Okay.
So one also nuance in regards to 5-star that I will bring to your attention here is if a beneficiary moves and utilizes the 5-star, um, the copays that go towards MOOP, right? So the copays that go towards your office visits, your hospitalization, your medical care, any copays that go towards your medical care will not roll over to the new MAPD plan. But any out of pocket that beneficiary spent towards prescriptions will roll over. Okay, so that's the difference. If at some point in the year you utilize the 5-star SEP, and it doesn't matter when, but at any point you utilize a 5-star SEP, any of that beneficiary's copays that went towards medical is not going to roll over. Okay, so let's say they spent, I don't know, $500 in copays. Maybe they went to the hospital once and they saw their PCP a couple times and a specialist once. So they had $500 of out of pocket. That $500 will not roll over towards the MOOP on the new MAPD plan for 5-star. However, any copays spent towards Part D drugs will roll over. Okay,
They call that the troop, right? Instead of the,
correct.
yeah,
Correct. Yep.
okay,
So MOOP does not roll over, Troop does.
okay.
Okay. Um, so just one little nuance there. Now, what is it? Like 5% of beneficiaries even reach their MOOP, right? Out of pocket. So it's not likely to be an issue, but I just want to make sure you guys are aware of that. And if that question does come up,
Mhm.
okay.
Okay.
We do have enhanced dental and vision. Anytime you submit a new application, including 5-star, you would have the option of adding the enhanced dental and vision to that plan. This is just a snapshot of the electronic enrollment and what that looks like. So when you're submitting a 5-star SEP, you would, even if that beneficiary was with Priority Health on a prior plan, maybe they're on the Edge, a PPO plan, or maybe they're on a DSNP and they lost their eligibility, right? Or whatever. Maybe they just want to make a change. They could be on a PPO plan and just want to make a change to the 5-star. Any reason, doesn't matter. They would be given the opportunity to add the enhanced dental and vision, and you would simply do that by selecting the yes button there. And conversely, if they did have it, and they switched to a 5-star, they could opt out at that point too. So, okay, any questions about anything? We just took a lot longer than I was expecting, but
That
any
was great.
questions?
Let's see.
Now, what we can do is I kind of put together an abbreviated certification as well. Now, if you're already certified with Priority Health and just kind of want to review or have some questions, great, we can certainly do that. Or if you're not certified, I can certainly spend some time on this as well. At the end, I do have kind of the steps to become certified, as well. So, but any questions about what we just kind of talked about? And I think I was able to find chat. Look at that. There we go.
There we go. No, I don't see any questions out there right
Okay.
now. So yeah, if you haven't got certified, we can always get that set up later. If you're not on
Absolutely.
right now and you see it out on YouTube, we can certainly help you. You can get a hold of Rob or myself, and we can push that through and get it started, as well as for those that are not contracted with Priority Health yet. Feel free to reach out to me, Rob, and we can get that started for you and get that completed ASAP.
Yeah, and you do have some options. I actually have, with the anticipation that some of those agents who are not certified might want to get certified to utilize the 5-star SEP throughout the year. I've set up some scheduled certification classes that you can enroll in. I'm sure each of us sales reps would be happy to do a one-off if need be. And then also within our certification training platform, which is on Pinpoint, we do have a recording that you can watch as well at your leisure. Um, um, so the first step in that would be to, and I can kind of scroll down to that. I can say I have some highlights here and some of the other plans, and I'd be happy to kind of stay on and kind of go through any of these or answer any questions that you might have, etc. But next steps for certification kind of look like this. There's 2 steps. The first step is contracting. You can go to our agent Center login and just click on Get Appointed Agent Agreement. What that'll do is you can complete the paperwork. It'll go to our commissions team. We'll get you in the system. That takes about a week to do that, probably a little bit less. We're not in the heat of agent certification right now. Once you're contracted, then you go to our certification, which is here. This is what it looks like. You get all the boxes completed, and then you are certified. Our certification approach is a little bit different than some carriers. Our certification is open book. We look at it from the standpoint of, there's 55 zero premium plans out here in Southeast Michigan alone. We certainly don't expect you to memorize all of them. But what we do want you to have the ability to do is to acquire the resources needed to answer those questions as they arise when you're sitting with the beneficiary, right? So in here, we have resources tab. We have a slide deck similar to the slide deck that we just went through. With a Control F, you can do a search on that slide deck and have that open while you're going through the certification. We will accept Pinpoint, AHIP for CMS certs, as well as others, as long as they're approved by CMS.
Just one question that I had from an agent this week was about the connect option. Is there something that's called a connect option?
Well, our new enrollment platform for 2023 is called ConnectSure.
Right. Yeah.
Yeah.
So I was wondering if there was some other something else to that, but maybe I don't know.
Yeah.
Might have been referencing something else.
Now, if anyone does have questions about our ConnectSure enrollment platform, I do those trainings still as well. In fact, I have one this afternoon with an agent, a one-off. But if you think there's a need to kind of have me walk through that with some agents over ID, I'm happy to do that. I don't know, do you guys have your own platform that a lot of agents use?
Yes.
Yeah.
We do.
So if they use that, I'm not sure what platform that is, if it's ConnectSure or not. There's a couple, that.
Yeah, we use Trusty Care.
Okay. Yeah. So
So
yeah, and just so you guys know, the way that kind of works is Trusty Care collects the information based on their enrollment, generates a report, sends that to us, which we populate into a report that sends to CMS. So it's just really a tool to kind of capture the information needed, generating in a report that we can download into our system and then create our report to forward it to CMS for.
well, that was some very good information and appreciate your time. Does anyone have any questions before we end or would like to get certified? Well, thanks again, Rob. That was great information. Lots of things that we don't always think about, but need to know.
Yeah. No, I think a great opportunity to continue to grow your book. 5 stars. I mean, it's kind of a catch-all, right? I mean, it's just a great opportunity, really is.
Absolutely.
So, but any other questions? Don't hesitate to reach out to your rep. We're always happy to help. Yeah, anything else that I can do, just let me know.
Great. And then we have another, I think it's next week, Wednesday as well. We'll be capturing another segment. So stay
Yes.
tuned for that.
Yep. So we have another one of these, and then I think we have 2 other meetings scheduled on different topics. I think the one next week is also kind of 5-star based, and then I can't remember the other 2 topics.
We're going to cover the DSNP and
DSNP was one. Yeah.
ConnectSure.
Oh, and ConnectSure. Okay.
So that's a good one. Yep.
So
perfect. Well,
right.
Everyone has a great day, and thanks again, Rob. We appreciate it.
Thank you. Appreciate the opportunity.
All right. Thank you.
Bye-bye.
Bye-bye.